Welcome to The Explainer. Today, we're breaking down the key information about low-dose methotrexate. You've probably heard of it. It's a super common and effective medication for conditions like rheumatoid arthritis. Our whole goal here is to make the official guidance totally clear and easy to understand. Starting a new medication, it can feel a little overwhelming, right? So many questions. Well, that's exactly why we're doing this. We're going to turn what's often a really complex medical document into a straightforward guide. We'll help you understand how this drug works, and, the most important part, how you and your doctor can work together to manage it safely and effectively. Okay, so first things first. Before we go any further, we have to make a really critical distinction, because the methotrexate we're talking about today, it is not the same drug you might have heard about in other, much more serious contexts. All right, this slide right here, this is probably the single most important thing to get your head around. We are focused only on the low-dose therapy for arthritis, over on the left. The key word here is weekly. And look at the dosage. We're talking about milligrams. Meanwhile, the high-dose stuff for cancer treatment is measured in grams. That is a massive difference. And it's everything when it comes to understanding how this medication works and what its side effects are like. Okay, now that we've cleared that up, let's talk about what most people might actually experience. And here's the good news right up front. Side effects are pretty common. Yeah, but they're almost always manageable. They're not usually a sign of something scary. So here's a rundown of the most common things people report. You know, stuff like a bit of nausea, maybe a headache, or noticing some mouth sores, even some mild hair thinning. And yeah, these are definitely not fun to deal with. I get it. But the key takeaway from all the medical guidance is that these aren't typically a sign of real danger, and there are almost always ways to manage them. You know, understanding the timing of these things can be super helpful too. They don't all just show up at once. For instance, any nausea you might feel usually pops up in the first day or two right after your weekly dose. But something like hair thinning, that might not show up for a few weeks. So think of this as a kind of roadmap for what to expect and when. So here's the crucial part. You don't just have to grit your teeth and bear it. For every single one of these common side effects, there is a game plan. There is a management strategy. And it almost always starts with a simple conversation with your doctor about easy fixes, like tweaking your folic acid or, if you need to, your methotrexate dose. Okay, so we've covered the common stuff. Now we need to talk about the rare but serious risks. And look, it's totally natural to be concerned about these. But what's most important to see here is the actual system your medical team has in place to watch for these things and, hopefully, prevent them from ever becoming a problem in the first place. So it really boils down to three main areas that your doctor is going to watch like a hawk: your liver, your lungs, and your blood cell production. And just to be super clear, the monitoring is in place not because problems are common. They're not. It's because on the rare chance something does pop up, catching it early is absolutely everything. Just look at this proactive safety net for your liver. I mean, before you even take a single pill, you're getting screened for other conditions. Then you've got the regular blood tests, the folic acid we'll talk more about, and advice on alcohol. It creates all these layers of protection. See? Managing risk is a planned process, not just reacting to a problem. And this schedule, this is another huge piece of the safety puzzle. They check your blood pretty frequently at the start, and then regularly after that. Doing this allows your doctor to spot any tiny change, any potential issue with your bone marrow, way before it could ever become a big deal. All right, so given everything we've talked about, what's your role in all this? This part is all about you, about your active role in making this treatment as safe and effective as possible. You can think of this as your personal safety playbook. So what's your number one tool, your secret weapon for prevention? According to all the medical guidance, it's this right here, folic acid. It's just a simple B vitamin, but taking it makes a huge difference in cutting down on those annoying side effects we talked about, like nausea and mouth sores. And the typical starting dose is just 1 milligram a day. It sounds like a tiny amount, doesn't it? But it is incredibly powerful. And it's not set in stone either. If you're still getting side effects, your doctor can totally adjust this dose. It's like a little dial they can turn to fine-tune a treatment just for you. The importance of this simple step, well, you really can't overstate it. This quote from the official guidance is just so important. You see that grade 1A at the end? That's the highest possible recommendation in medicine. It's like a gold stamp of approval. It means the scientific evidence is crystal clear. Taking daily folic acid isn't just a good idea, it's considered absolutely essential for anyone on long-term methotrexate. Okay, so here it is, your checklist for success. Number 1, take your folic acid every day. 2, tell your doctor about everything else you're taking, even over-the-counter stuff. 3, report any new or persistent symptoms right away. And 4, this one is the most critical of all, never ever take your methotrexate every day. It is a once-a-week medication. Taking it daily is the #1 cause of serious problems. So, once a week. Got it? All right, let's wrap this up. What's the one big takeaway from this entire explainer? What's the one thing that ties all of this together? Well, it's you. It's the partnership between you and your healthcare provider. This medication, methotrexate, it can be truly life-changing for so many people. And understanding how it works, knowing what to watch for, and taking those simple safety steps, that's what changes everything. It turns you from just being a patient into an active, empowered partner in your own health. And that is the real key to making this treatment a success.